Miss Lucinda, 23 years old female, presented with the problem. Her BMI is 23.5. Take focus history, focused examination, and discuss management plan.
Can
Okay,
I start, sir?
yes, start.
Miss Lucinda, I'm Dr. Sajivani, your GP today. How can I help you?
Hello, doctor. Doctor, I'm here because I'm suffering from a very bad headache, doctor.
Okay, I'm really sorry to hear that. Can you give more detail regarding that?
Yes, doctor. I think it started 6 months back. So it's like not settling. So I thought I used to try some medication, but as it's not improving, and now I'm little scared that if there is anything wrong with me.
Okay. Have you experienced your headache in the what's the time of the day? Most of the time?
Not related to any time, doctor. It's there during the daytime, sometimes during the night. I didn't any part of the day specifically.
Oh, any vision problem?
No, doctor, no vision problem.
Okay. In pain score, in there is no pain like 0 and your maximum pain is 10. What's your score?
It's very severe, doctor. I think it's around 7.
Okay, then. So, are you any fever?
No.
Are you having any fever? And photophobia? Like you can't see the any lights?
Yes, doctor. I feel sometimes like that. I feel very irritable when I see the light.
Is that which area you would get this headache?
It's towards only one side. Most of the time, it's toward the right side.
Have you, when you're touching your that area, have you got some tenderness?
No. When I massage, I feel good.
Okay, then. So, are you on any drugs?
Not any regular medication, doctor, but I take paracetamol.
Are you having any recurrent respiratory tract infections?
No, no, doctor.
Okay, then what's your menstruation? How is your menstruation?
It's normal.
What your last menstrual period? When was that?
It was 2 weeks back.
Okay, then. So, how about your stress level? What are you doing for living?
I am a IT engineer. So as I'm working for a foreign company, most of the time during the night I'm up. So that disturbs a little bit of my sleep, and it makes me a little bit stressed.
Okay, then. Have you experienced some injury related to that before 6 months?
No, doctor, I don't remember anything like that.
Okay, then. So, what do you think? Any family history of because of I want some diagnosis. That's why I'm asking these things. Are you experiencing in some family history of this kind of headaches?
Yes, yes. My mother had a very bad headache, I remember. She also suffered with this headache.
Okay, then. I'm asking you a personal question. Is that okay with you?
Yes, sure, doctor.
Okay. What about your smoking habits? Are you on smoking?
No, I'm not smoking.
And any alcohol intakes?
No, doctor.
Okay. And what do you think? What's the cause of this headache?
I thought maybe it's the stress or the sleepless nights, but as it's not settling, as it's improving, I'm little concerned that if there is anything growing inside my head.
Mhm. And any particular worries regarding that?
I get it around 4 times a month. So it disturbs my day-to-day activities. I'm unable to concentrate. I'm working on a,
Okay.
yeah, as I'm
Oh,
working on
yes.
a project and I'm having very less time. This headache really
Mhm.
disturbs me. So I'm worried if there is anything sinister.
Okay, don't worry. I will explain and uh, I will help you definitely. Any particular expectation from me today, your consultations?
Yes, doctor, I need some strong painkillers.
Mhm. Are you having any previously, are you any try with some medications for that?
Most of the time I take paracetamol, and sometimes I get very little response for paracetamol. Then sometimes I take Brufen.
Uh,
Uh, it
what
settles,
about? Uh-huh.
but nowadays it seems like it doesn't respond even for Brufen. Doctor, do you think that I should do a MRI?
Okay, after examination, I will give you the definite diagnosis and I will explain to you. Is that okay with you? After I examine you, I will give you the some details regarding that. Is that okay with you?
Yes, no problem, doctor.
Okay, in a summary, I want to recap your summary. 23-year-old Miss Lucida, you came with a 6-month history of headache. Its pain score is 7, and you tried with some paracetamol and NSAIDs. A little bit improve with that, and there is a photophobia and family history with the mother having same kind of headache, and your expectation from me regarding some further investigation like a MRI scan. Is that so? And do you want to add something more?
Yes, that's it, doctor.
Okay, then I would like to examine you with privacy is maintaining and chaperone is there, and I sanitize my hands. I would like to start with your general examination like febrile or not, pallor or not, and blood pressure, pulse rate. And I want to examine your back of the eye also, and whether there is any temporal area tenderness there or not, and any uh, muscle, neck muscle movement with the head extension and flexion, uh, side of the lateral, medial lateral, both side of the head, and a neurological examination of the cranial nerves. Is there any positive findings?
Uh, yes, doctor, the examination is there on the screen.
Okay, Mr. Sudha, most probably you get a migraine headache. Uh, in this condition is don't worry regarding this medical term. It's some sort of your uh, brain nerves get some stressed with things, and it can be cured like you can get some medication, and you can get further relief. Is that okay with you?
Yes, doctor.
Okay, then there is a no like a sinister examination findings, and any sinister history findings not there. Like you are having some brain tumors, so like because of that you don't get any hesitation to that, and you can try with some lifestyle modification also. In this case, you can reduce your some trigger factors. There are some foods intakes. You can modify it with some sort of foods. You can aggravate your headache, like chocolate and caffeine, coffee, and things. Some sort of these foods you can reduce. In a person to person, it's vary. In your case, you are you having some foods triggers this headache?
I didn't notice such, doctor. Doctor, is there any long-time medication I should take to prevent this headache?
Yes, long time medication also there. You can try with the propanolol, and I will give the clear prescription for that also. And you can try with the sumatriptan. Is that okay with you? In
Oh, yes, doctor. If the pain is severe, what is the drug I should take? So when it's not settling for ibuprofen?
you can take a sumatriptan and propanolol both.
Okay, doctor.
Other thing is that you can do the lifestyle modification and exercises, and your weight little bit. You can reduce your weight also in with exercises and weight reduction. Your relaxation also there, and you can cut down your chocolate and caffeine things. And meantime, if you got any fever, if you got some early morning headache with vomiting, or any numbness of your arms or legs, you can directly go for emergency department, or you can contact with me. In the meantime, I can arrange for some supportive groups. There are migraine supportive groups there, and I can arrange some referral for migraine supporting groups. There you can share your ideas and other patients. Then you can get a better idea. And in meantime, you can I can give you some leaflets regarding the migraine.
Time is over.
Okay.
Okay, doctor. Thank you.
Okay. Thank you.
Okay, thank you. Okay. So this is a migraine headache. Good. The thing that you have missed, one is the first about in the history, the red flags need to be asked. First, you said if you develop any early morning headache, vomiting, or headache during the sneezing, coughing, those things are the red flag. You said that if you develop anything, go to the emergency department. But in the history, we need to ask whether you have these kind of symptoms, because the headache history, red flag is very important. That things I have noticed. Other one is the aura. Whether the patient having any symptoms like flickering of light, flashing, zigzag line seen before the headache. So you can ask like, have you ever noticed uh, any symptoms before the headache, like flickering of light, flashing, zigzag, like that. So because this is a migraine without aura. So if it is there, so we have to consider it is migraine with aura. The next one is the relieving factors. Really, she has a when she take rest, or if she go and sleep in the dark room, so it gives a little bit relief. So that is also have to ask. Other thing is, I have noticed this is a focused examination. She is a 23 years old. So checking the temporal arthritis is very unlikely, because temporal arthritis is usually more than 50 years, one thing. Other one is in the management, you said that weight reduction, but her BMI is just 23.5. So weight reduction is not necessary in this case, because she is a normal BMI. Yeah, those are the things I have noticed. Other than this, everything is good. Good, Dr. Sajivani. Right, we'll see the case properly. She is Miss Lucinda, 23 years old. She is a IT engineer working from home for a foreign company. Most of the time, she works in the night. Because of work, she has a lack of sleep. And also recently, she is doing for a project. For that, she is under stress. Here the trigger factor is reduced sleep and the stress. So the precipitating factor need to be addressed in the management. So otherwise, even though we give the medications, it won't respond. So need to address about the sleep hygiene and also stress. Then we have to elaborate the headache with the Socrates usually. Whatever the pain, it's better to uh, evaluate with the Socrates because everything will come in that evaluation. The side, yes, mean side. So it's in one side. So right side. O mean onset. It's a gradual onset, not a sudden onset, right? And also character is a throbbing like headache. Radiation, there's no radiation. Associate factors, she is nausea, vomiting, and she cannot see the light, which means photophobia. She cannot tolerate the noises, that means phonophobia. And uh, T mean timing. There's no time related to early morning or in the evening. So if it is early morning headache, so it more towards the SOL, and the evening headache usually tension headache, and also the severity. The severity is around 7 out of 10. And also we have to ask it how long she says. She has a 6 month, and also how frequently happening because we need to consider about the prophylaxis. So if there is a more than 4 attacks per month, then we have to consider the prophylaxis. So if you take those history and also ask about the red flags, is there any morning headache, vomiting, headache, not uh, headache is worsening during the coughing, sneezing, and also ask about the fever. So all those things give a good picture. And also there's no past medical history. Drug history, she takes paracetamol, sometimes Brufen, which gives a little relief. And in family history, her mother had a bad headache, and also she used medication for some times. That means she may have used some prophylaxis medications. Menstrual history is regular, and the headache is not related to the menses. Contraception is unmarried, sexually not active, and not using any contraception. Socialist IT engineer, living with the parents, no smoking, alcohol, or any recreational drugs. Her concern is her ideas. He has no any idea what is happening. Maybe related to her lack of sleep and stress. She has self-identified some precipitating factors, and other one is the concern. She is concerned that whether it is any sinister symptoms, and also she asking whether she need MRI. Expectation is she need a strong painkiller. So examination also need to be focused, general examination, and also focused, especially check the blood pressure, and also check the fundoscopy. Those two are the very important things. And also you have to say that I would like to do a full neurological examination, including cranial nerve and motor and sensory, because we don't have a time to do all the neurological examination. So if you do that, that's enough. So there will be a not much finding, but history clearly say that it could be a migraine without aura. Then the management, you can say that it's likely a migraine headache without aura. Don't worry about the medical term. Have you heard about this? No, doctor. So it's a type of headache, but we can manage the condition with some lifestyle modification and some medications. So how it is sound, Mr. Luzinda? Yes, doctor, it sounds good. Please explain what I do. So first thing, I will explain the things that you have to do. The first things I have noticed, the lack of sleep and stress. So please have enough sleep, at least 78 hours per day, and manage your stress with you. You can take some regular rest, and please reduce the screen time also. With you can go for some exercise like walking or whatever, swimming, whatever you can, and also do some meditation and mindfulness yoga, which will give us some stress reduction. In how it is sound, Mrs. Lucinda? Yes, doctor, I will try to do that. Then the pharmacology management, you can say, though, I would like to write some medications. One when you are having the pain. So that is, we'll start the paracetamol and the medication called naproxen, right, with the omeprazole. With the domperidone, which mean that is for your nausea vomiting. Even though if you don't have it, it's better, yes, to start the domperidone. So we can manage with this. If there is a very severe headache which is not respond to those medication, there is something called triptans. There are various medication available, sumatriptan, sumatriptan. So I will write it. So once the headache is starting, so please take at the initiation, so that will give a good relief. So shall we do that? Yes, doctor. So she is asking, doctor, I'm having this headache, a frequent headache, more than 4 times per month for last 6 months. Is so disturbing. Do I need any long-term medication? So you can address, yes, it's good that you ask. Well, there are medications that control the uh, frequent headache. That is something called propranolol. That is the first line medication for that. So, Ms. Linda, do you have any asthma? Have you diagnosed with any wheezing? She said, no, doctor. So I will can start the propranolol. So it has to be taken for some time. At least you may need to take for 6 months. Uh, we can start with the low dose like 40 milligram in the morning, and we can adjust accordingly. So shall we do that? Yes, doctor, that's good. So much, Lucinda. So while you are taking this medication, if you develop any worsening of headache or the headache is not responding, or if you develop any early morning headache with vomiting, please come and meet me immediately. At the same time, I would like to review you in 2 3 weeks time with the something called headache diary. I will explain. There are diary for that. So you have to write it down when you are developed the headache, how frequent it happening, how the severity, what are the medication you are taking at that time, and also how the response. All those things, please write it down and come so we can get a good idea what is going on. So shall we do that? Yes. So Ms. Lucinda, do you have any questions? No, doctor. So we will meet in 2 weeks time. Okay, then thank you so much. So if you do those things, that will be enough within 10 minutes, and you can pass this station easily. Right. So anything you want to add about the migraine?
Do we have to exclude cluster headache here?
Cluster headache is something different, right? Cluster headache usually happening in a seasonal. That is one side headache with the tearing and also nasal discharge. Very severe headache usually happens in the evening or the night. That is picture a little bit different, right? If you ask, she had a similar headache 6 months back, like that. So this is history clearly suggests one side throbbing headache associated photophobia, phonophobia, nausea, vomiting, and related to the stress and lack of sleep. Mother had a similar bad headache, like it seems like migraine. So this is more towards the migraine headache, but cluster headache is a little bit different history. So we'll do a cluster headache also. There are a lot of OSCEs in headache, cluster headache, migraine, uh, this one, giant cell arteritis, meningitis, uh, and also SOL. So 5-6 type of headache are there. So this is a migraine most likely. Yes, anything you want to add?
The SH, what's the sinister feature?
You mean hemorrhage?
Yes.
It's a the club headache, right? The headache that patient feel is a very worse headache in the life. And also is usually elderly people or something after the sexual intercourse like that patient will come after the emotional this one. That is very severe headache. Patients come and say, I never had a such headache before, doctor. Very severe. So it's a progress increasing, not respond to any medications. So those things that we have to admit as soon as possible.
And a history also like acute onset.
Yes, it's very acute.
Oh.
Yes, within a 1 hour's time, patient come.
Oh.
There is a chapter about the headache, how to evaluate, and also what are the sinister features of every headache in the Oxford Handbook. So please read, you will get a good idea. And also about this prophylaxis, there are first line is propanolol and topiramate. So if a patient's coming and saying that I'm getting married, so we cannot give the topiramate. It has some teratogenic effect. And also if a patient on OCP, also we cannot give the topiramate. But other patients we can give. It's a good drug. But the first line always go for a propanolol. And sometimes amitriptyline, gabapentin, all those medication also can be given for as a prophylaxis. Right. So we'll move to the next case. Leave and rejoin, please.